The average weight of men and women in America right now is more than a dozen pounds higher than it was in 1990. That's according to a recent Gallup poll. What has not changed, though, are the rigorous standards to protect our country.
And that's causing some members of the military to go to extremes to pass the so-called tape test.
Well, tonight, News 4 San Antonio's Melissa Vega is digging into what they're doing, not only to look physically fit, but also to secure their family's future.
They make the ultimate sacrifice for our country. Our heroes, the men and women who protect our freedoms.
Military people are still human.
That's exactly why some may be going in for a little nip and tuck.
Are you seeing more military men and women opting for plastic surgery to pass the fit test?
The difference between a military and an average citizen is that there's a tape measure test. And even when you're fit, and you're considered fit by me, a tape measure might not consider you fit, which is unfair.
The tape test measures body fat by calculating the measurement of the neck and waist, plus hips for women, and comparing it to height and weight. Only certain service members have to take the tape test, and before they do, certified plastic surgeon Dr. Thomas Jeneby says he'll see 5 to 10 of them a month for liposuction.
They come to me and they say, I'm fit, I can run a mile in 7 minutes, I can do a ton of pull-ups, I can do a ton of sit-ups. I'm not going to pass the test like this.
One of Dr. Geneviev's clients spoke to News 4, but didn't want to be identified.
Well, for the majority of the women that do the tape test, it has to be based on their measurements from their neck, their waist, and their hip line. And majority of the women have that problem where it's in the hip area.
She had fat taken out of the lower part of her upper thighs.
I don't regret it because I did really well on my fitness exam. It made me feel a lot lighter. I feel more confident.
She says passing the tape test goes far beyond physical fitness. It can delay promotions, and if you keep failing, it could even lead to a discharge.
You have that one thing that hindered you. That could separate you from the rest of the crowd.
By no means is surgery a permanent fix. Military members still have to work out, eat right, and maintain their shapes. Melissa Vega, News 4, San Antonio.
Good morning, welcome back. Summertime means breaking out that summer wardrobe. Dr. Thomas Jeneby is a well-known plastic surgeon here in San Antonio. Anissa Snyder is one of his patients. They are joining us this morning. Good morning.
Good morning.
How's it going?
Good.
Looking good, Miss Anissa.
Thank you.
So you recently had a procedure, a very popular one still to this day, right, Dr. Jeneby?
Of course. Breast augmentation is the #1 procedure in the United States for women, and liposuction is the #1 in the world.
Wow. So I want to talk to Anissa about your experience. So I think things have changed a lot when it comes to breast augmentation. You have a lot of options, right?
Yeah, go ahead, Anissa.
Yes, I went to Dr. Jeneby and I was looking to have breast augmentation. At the time, I wasn't certain what size I wanted to be, so he strongly urged me to consider adjustable implants. So I went with those, and it was by far the best decision. This man is an artist.
That's what I hear.
I mean, he's just amazing. And I've actually had 4 adjustments since receiving the implants 5 months ago.
Okay, so tell me about the adjustable implants and how they differ from traditional. Clearly, you can change the size, right? But for how long after the surgery?
The adjustables are basically an expander, but that turns into a regular implant. You have 6 months.
Really?
And everyone changes their mind.
I'm sure.
I mean, Anissa's did it 4 times. There's women do it 2, some do it 5. I mean,
how does that work, though? So you go in and you think you have an idea again, of what you want, and they tell you, and you go, okay, and then they can come back as many times and say, oh, it's a little too big. Maybe they're a little too small, and you just go.
Yeah, I mean, it's not
right?
like wedding, funeral. You know, you have to get an idea, like kind of where you're going to be at. But what they do is after surgery, about 3 months after the initial amount we place, which we discuss ahead of time.
Sure.
You come in the office on your lunch break, and we put 2 small little needles into the skin, and we fill them up, and it doesn't hurt.
So cool.
And you can even bring the bra you like.
Well, I mean, you're spending a good amount of money. It's an investment, so you want them to be just right. Your girls.
Yes.
You want them to be just right for your body. So how are you feeling now? I mean, they look fabulous. Can I say that?
Thank you.
They look fabulous.
Yes, I absolutely adore them. If I could be sitting here topless, I probably would. They've absolutely changed my life. The image I have about myself, this man is responsible for me waking up every day and loving what I see in the mirror.
Well, congratulations.
So, yes,
Anissa.
thank you.
You look beautiful.
Thank you.
Now, breast augmentation is #1, big trend still, but also lipo is very popular too, as well.
Yeah, now lipo does involve some surgery, of course, and of course you should never just go to a place that doesn't have a board-certified plastic surgeon deciding whether you have lipo or non-invasive. Of course, this segues into our non-invasive options now. I'm the first in San Antonio to get a procedure called Vanquish.
Okay.
It is a radiofrequency lipo that goes above your body, it never touches you, and for 30 minutes you get heated up.
So this is before and after,
Yes.
and this is from the Vanquish?
Yeah, that's part of the Vanquish, it is, absolutely.
So tell me about this. Is this an in and out? I mean, clearly it's non-invasive, so it doesn't hurt.
No, it doesn't hurt. It feels like a hot stone massage. You do 4 to 12 treatments. There's no downtime. You go back to work.
Really?
It doesn't substitute for what I can do for an hour in the operating room, but for people who are scared, who can't tolerate it, it certainly is a nice option.
Got it. And can you do that anywhere? I mean, what are the main areas you're doing the Vanquish?
Yeah, mainly it's lower abdomen and flanks, but they're getting attachments for arms, and we get them sometimes for saddlebags, medial thighs, you know, all
those fun areas.
all the bikini areas.
I know, I do. Well, Dr. Jeneby, you are just sensational. You have a fabulous reputation here in San Antonio, and if people are thinking about having something done or just getting information and finding out if what's right for them, they can come and see you.
Yes, they can.
You are such a wonderful doctor,
Thank
and
you.
you also have a special offer.
Yes,
for our first 10 callers.
First 10 callers receive the Vanquish for $99 for one treatment, just to try it out. It's normally $699.
Oh my goodness!
So you're saving $600
Wowzers.
today. Also, we do have a special on Facebook and my email for a breast dog for $49.99, almost $1,000 off.
Oh my goodness, that is awesome. Just in time for summer. And again, you can go and see Dr. Jeneby. He's on Wurzbach Road. The phone number is 270-8595. drjenebeplasticsurgery.com. Thanks, guys.
Thank you.
And congratulations.
Thank you.
Joining us this morning on San Antonio Living. Here's what we have coming up for you tomorrow. Just in time for summer, we're checking out some of the newest additions at Six Flags Fiesta, Texas. They've got something called the Bahama Blaster. We're going to tell you all about that. And if you're interested in getting into the real estate game, the must-attend event to get you started with information and networking. We've got that and a whole lot more tomorrow morning at 10 a.m. All right, summertime, spruce up time. If you're considering, letting the body, getting it shaped up, we know exactly who you should see. Dr. Thomas Jeneby is joining us this morning.
Hello.
And of course, Anissa Snyder is here, one of his patients. It's good to see you guys.
Always a pleasure.
The old summer tune-up, it's time. So what's trending right now when it comes to plastic surgery?
In my office, obviously, breast augmentation season has started. And so we're offering a combination of breast aug with lipo. And of course, I do adjustable breast implants,
right,
which I've been doing now 10 years, and we do the most in the country right here in San Antonio.
People at home, they're like, what, adjustable breast implants? How does that work?
Anissa, why don't you go ahead? She's one of my great patients.
Yes. Okay, so tell me, Anissa, first, you went in, you wanted to have your breasts done.
Yes.
And did you know about the adjustable deal?
I actually did not know about the adjustable implants going in to meet Dr. Jeneby. He told me because I was unsure of what size I wanted to be. I've never really had boobs in my lifetime. So he highly suggested that I go with adjustable implants.
Okay.
And it was a very easy procedure. Recovery was nothing. Pain was never more than a 2.
Really?
Yes. And the soreness was gone away in like a week.
Wow.
Yes.
Okay, I know women who go in for breast implants and they come out and they're like, oh man, they're too big. And so they wait a while and then they have to undergo another surgery. And then they're like, oh man, they're too small. And then they spend another thousands of dollars. This solves that problem because you don't have to keep taking them in and out. You can just adjust them.
Yeah, I mean, it's called breast remorse. And the number one reason people go back to surgery from breast augs is 37% go back for size change.
Right.
37%. In my hands, it's 0.05%. because you have these 2 devices in for only 6 months. They're out after 6 months. You can adjust up to 3 and 4 and 5 times.
Amazing.
It's awesome.
Okay, so did you start out too big or too small?
I started out too small.
Like everybody.
Yeah. You know, it happens. You don't want to go too big, or you're nervous. But you're right. You can change them up to 6 months out. That's a really great invention there.
Yes. It's revolutionized what I do. I don't do any other surgery but that. And most surgeons will do something they're comfortable with and that works. And now it's been 3,000 or 4,000 patients. It works. It's awesome.
Who's a good candidate for the adjustable breast augmentation?
I don't have any bad candidates. I would say that most women they listen to too many people about their breasts. You know, they just come in, I don't want them too big. And all of a sudden they're like, you know, Dr. Jeneby, you were right. I shouldn't have listened to anybody. I'm glad I had these.
Right, okay. Okay, so how many times did you have them adjusted?
I've had them adjusted 4 times already.
And so when you go in, it was just a little pump of air, or what? How does it work?
Actually, through the ports, a needle is inserted, totally painless, inserted under each port, under each breast, and saline solution is injected through them.
How long does that take?
Less than 5 minutes.
Wow, okay. So are you happy?
I am very happy. I am very happy. I mean, he's an amazing surgeon. I cannot give him enough props for how much he's improved the quality of my life. I mean, I look hot naked.
Hey,
that's what matters.
You look hot with your clothes on, too.
Yes, thank you.
Okay, so let's talk about, this is one option for you, but you've got something going on called Vanquish, and you were here a couple of months ago. You debuted the machine here on San Antonio Living. What does that machine do, and how are your results coming?
The Vanquish machine is a radiofrequency device, fits over your body, as you remember. It never touches you, and for 30 minutes you sit there, you talk, you hang out, and then you get up. Your body changes in the next couple of days, whereby the fat that was radiated by this radiofrequency safe frequency starts to melt.
Oh, I like that.
And then you just start to absorb it. Now, it doesn't take the place of me for 40 minutes under anesthesia. But for people who are a little tepid, they don't want to undergo surgery, 4 to 12 treatments spaced 1 week apart. I see anywhere between 2 to 6 inches of contouring.
Wow.
And then we have a machine afterward that will shrink your skin.
Okay. If that's if you're looking for a little more than 2 to 3 inches, liposuction still a good option for some people?
There's nothing that really substitutes for a good board-certified plastic surgeon working on you. It's like a difference between autopilot and piloting. So, you know.
Well, you certainly do a great job. We're happy to have you here on the San Antonio Living Show. Anessa, thank you so much for coming and sharing your story with us.
Definitely.
Guys, it is the time to do it now before summer season is too far gone. We've got a very special offer for our San Antonio Living viewers this morning. The first 10 callers are going to receive $99 Vanquish treatments, and that's the machine that melts the fat. And again, that is with Dr. Thomas Jeneby. If you're looking for any other services, he is a board-certified plastic surgeon, and he specializes in adjustable breast implants. All the information is there on your screen. Dr. Thomas Jeneby on Wurzbach Road. The number to call for a consultation is 270-8595. Again, 270-8595. And don't forget, the first 10 callers are going to get that $99 Vanquish treatment. All the information there on your screen.